The deadline to sign up for federal health care is quickly approaching, and perhaps you still have a few questions. Lloyd Coleman is the president of the Utah Association of Health Underwriters. Thanks for being here, and you're here to help us tackle some of those questions that people still may have. Let's start off with, we've been hearing a lot about the Affordable Care Act. When is that deadline? Well,
there are actually two right now. This Saturday, the 15th, is the deadline to apply for coverage and be approved if you want effective dates of April 1st.
Okay.
And then the last day of this month, the 31st, which is a Monday, is the last day to buy insurance for the year. And so if you want any insurance this year, you have to do it by the end of this month.
I'm sure there are plenty of people watching, plenty of people who are thinking about signing up but have waited to the last minute. What are some of those questions that you're hearing from people?
There are a lot of those. First of all, about this deadline, a lot of people assume that if they want to get a subsidy, it's the deadline, but it's not just for them. Anyone who wants to buy individual coverage, that's the deadline. And so even if I want to pay full price for coverage, I can't do it in June and go to a carrier and buy it directly. Even then, I have to buy it by the end of this month. Otherwise, I can't buy it for the rest of the year.
So you'll be without health care for the whole year.
Yes.
If we file our taxes late, right, after April 15th, there's a penalty, but you could file an extension to not get that penalty. Anything like that with the Affordable Care Act?
There is not. That's the deadline is the deadline. There's no more extensions for that, and you can't buy it the rest of the year. Now, having said that, they have moved other deadlines all along now. They've changed deadlines on other parts of the law all along. There's rumors and talk about moving this deadline, but so far, no indication that they would change the deadline for the last day to enroll.
So as far as we know, March 31st is that hard deadline?
Correct.
Now, people who want to sign up, this is all done online, right, at healthcare.gov. Can people find help? Are there still those centers where people can go to, like we saw when the healthcare.gov first was started?
Yeah, and so the navigators were put in place, and they're part of the system to help people do that, but they have some limitations in what they can do. And I think the biggest unknown thing about this is there's some help that's available that's built into the system. So every carrier pays a commission that's included in the premium of every plan in Utah, and that commission then goes to a broker, and the brokers have been certified to help people with these ACA plans or help them make a choice off of the ACA if that's a better choice for them. So they can help them either way, and they can help them look through all the stuff that's important to them decide. It's really confusing for a lot of people, and that's what I brought this for.
Yeah, so show us this. You had a really great analogy for this.
This is the Rubik's Cube. A lot of us have seen this from our childhood and played this game, and if you don't know how this works, you can spend hours trying to get everything to line up.
Exactly.
And when I see this, I think about people who don't know about health care. And they look at this and say, okay, I have deadlines and I have penalties, but then there's networks and deductibles, and how does that work with an out-of-pocket max?
Yeah.
And is co-insurance part of the out-of-pocket max? And how about when I get drugs? Is that covered?
My head's
and
about to
is my
explode.
doctor on here? And I'm trying to get them all lined up, and every time I go here, it's just not working for me. How can I get some help? But there are people that can take these in 30 seconds, figure it out for you.
Exactly.
And so that's part of the program. Those agents or brokers can help them do that.
So you have to find those people. Where's an easy place for people to go to find out who can help them in their area?
Well, we have a website here in Utah called Enroll Now Utah. And if they go there, they can do a search by, if they know a broker, they can search by their name, or they can look by geography and find someone who's close to them. And the people on that site are known to have been certified in the ACA and be experts in helping people find the help they need. And they can help them look through all those options and say, you know, is it a certain doctor that you need? How do you use the health care? You say there's silver plans, but there's 20 silver plans. Aren't they all the same? But they're not.
Right.
You know, every silver plan may have a different outcome based on how you use health care. Maybe you're looking for a surgery this year, you want one with a really low out-of-pocket max. Or maybe you don't need a surgery, but you want to look for a low copay. Maybe you're trying to get your drugs covered, and so they can help you choose the plan that's right for you.
So we're trying to put the pieces to this puzzle together. There are people that can help us. We'll put a link to that on forutah.com. Lloyd Coleman, thanks so much for joining us.
Thank you.